Bismillahirrahmanirrahim. Hope you all are safe and sound in your homes. May Allah bless you all. I'm going to start my topic, which is anatomy of lungs. Learning outcomes of this session, which we have to achieve at the end of this session, are describe the surface anatomy of lungs, illustrate the anatomical division of both lungs, define root of lung and enlist the structures passing through it, give neurovascular and lymphatic supply of lungs, enumerate 5 differences between right and left lung, draw bronchial tree and its components, enumerate bronchopulmonary segments and give their clinical significance. First of all, the introduction of the lungs. As we all know, lungs are the major respiratory organ of the human body. In human, lungs are pair of respiratory organs situated in thoracic cavity. These are protected by the thoracic cage. The bony thoracic cage is formed by the ribs, the sternum anteriorly and posteriorly from the vertebral bodies, the thoracic vertebrae. Both lungs are separated by mediastinum. This is the midline portion called as the mediastinum in which the major structures, major blood vessel and the heart lies. Structure of the lung is very delicate. It is just like a sponge, and color in young it is brownish gray in color, but with age it becomes mottle black due to deposition of the inhaled carbon particles and pollutants. Right lung is quite heavier than the left lung. It is 700 grams in weight, while the left lung is 600 to 650 grams in weight. Then come towards the journal feature of a lung. Each lung is conical in shape. As we all know what is the cone? Cone shape, just like a cone of a cornetto. It is in the lung. This conical lung is composed of the apex, the uppermost part, and the lowermost part known as the base, the three borders which are anterior, posterior and inferior border, and two surfaces, costal and medial. Medial surface is further divided into its mediastinal part and the vertebral part. Vertebral part is the area surrounding the vertebral bodies, and the mediastinal part surrounds the mediastinum portion. Now comes the base of the lung. Base is the lowest portion of the lungs on both sides. As we can see in the diagram, it is semilunar and concave. The concavity can be easily appreciated. It rests on the diaphragm and it separates the right lung on right side from the right lobe of liver, and the left lung from the left lobe of liver, fundus of stomach and spleen posterior. Then the borders of the lung. As we have already discussed, there are three borders: anterior, posterior and inferior border. The inferior border is thin and shorter than the posterior border, as we can see in the diagram, and it corresponds to the interior costomediastinal line of pleural reflection. Interior border of the left lung shows cardiac notch below the level of fourth costal cartilage. This cardiac notch basically accommodate the cardiac slit or accommodate the heart in the mediastinum. The posterior border is thick and extends from the C7 to 10 vertebra level. Inferior border Inferior border basically separates the base from the costal and medial surfaces of the. Then comes the surfaces of the lung. There are two major surfaces, the costal surface and the medial surface. The costal surface is large and convex. It lies in contact with the costal pleura and overlying thoracic wall, while the medial surface is further subdivided into two parts. The anterior part, known as the mediastinal part, related to the mediastinal septum, and posterior part, known as the vertebral part, it is related to the vertebral bodies, intervertebral disc of the thoracic vertebra, splanchnic nerves, and posterior intercostal vessels. We can see in this diagram all the surfaces and the borders. The costal surface can be easily appreciated here, and the mediastinal part of the medial surface in the vertebral part of the medial surface. Then anterior border, and the inferior border. Till now we have discussed the basic anatomical parts of a lung that composed of its apex, its base, its three surfaces and the borders. Now we will move toward the division of a lung into different lobes. To divide the lung into different lobes, there are deep furrows known as the fissures which divide the lung mass into different lobes. First fissure is the oblique fissure. As the name designates the oblique, it should run obliquely. It passes obliquely downward and forward, crossing the posterior border about 6 cm below apex and inferior border about 5 cm from the median plane. On left side, it divides the lung into the superior lobe and inferior lobe, while on the right side, it divides the right lobe into the middle lobe and inferior lobe. Next comes the horizontal fissure. It runs horizontally. In right lung, it passes from the interior border up to the oblique fissure and separates the middle lobe from the upper lobe. It runs horizontally at the level of the fourth costal cartilage and meets the oblique fissure in the mid-axillary line. There is no horizontal fissure in the left lung, while the superior lobe of the left lung has a tongue-like projection known as the lingula along the cardiac notch area. There is no horizontal fissure. There is only one oblique fissure on the left lung, dividing it into the superior lobe and inferior lobe. Then the root of the lung. What is the root of lung? Basically, it is a pulmonary ligament extension, a short, broad pedicle which connects the medial surface of the lung to the mediastinum. It is formed by the collection of the structures that suspend the lungs from the mediastinum. Major blood vessels, major neurovascular structure, even the bronchi passes through this route. It lies opposite to bodies of T5 to T7 vertebra. This portion is called as the root. Lung root is formed by the following structures entering or exiting through the hilum. The first structure is the principal bronchus, then the one pulmonary artery. We can see in the blue color. Why in blue? Because the pulmonary artery brings the deoxygenated blood from the heart to the lung. Then the two pulmonary vein, the superior pulmonary vein and the inferior one, bronchial arteries, bronchial veins, interior and posterior pulmonary plexus of the nerves, lymphatics of lung, bronchopulmonary lymph nodes, and areolar tissue. Now we will summarize the major differences between right and left lung. We will differentiate them on the basis of the number of lobes, volume, number of bronchi, shape, base of lung, and weight. In the right lung, there are three lobes. It is larger in volume than the left lung. It has two bronchi. It is shorter and wider and more concave and is heavier than that of the left lung. While in left lung there are two lobes separated by only one single fissure known as oblique fissure. It is smaller in volume. It has one main bronchus. It is narrower and bit longer. It is less concave and lighter than that of the right lung.